All right, we can go ahead and get started. So welcome everyone to CTEC 2021. This is our second session of our virtual CTEC for this year. I know things are a little different doing it virtual, but we're so happy that everyone was able to join us and just happy that we can get together. I know Isham recently canceled their in-person, they're gonna go virtual. Kind of seems to be the trend nowadays. Hopefully this trend doesn't last. If you're like me, I'm over and done and tired of the pandemic and want to get back to normal. So anyways, today we're going to be talking about utilizing CensiTrac to reduce your IUSS processing. I'm Kelly Swails. I work as a Director of Clinical Services here at Census. At Census, the clinical team, which is my team. So we have a variety of tasks that we do, but the most fun thing that we do in our job is we travel the US, Canada, Puerto Rico, and we come visit your facilities and come on site there and we do a CensiTrac utilization assessment. So what that is looking at your account from A to Z, everything in your account. So there may be options or modules that you're maybe not using to their full potential, or we could show you a more efficient way to use them, or as new standards come out, new requirements from governing agencies, we can show you how you can document, record that in CensiTrac. So as I travel all these places, I see a lot of different hospitals, a lot of different things, and kind of take all that all in, and then work with with putting together our utilization assessments as well as presentations. So then when we do that utilization assessment, we then present you with a report, go through that, look at different Service Plus opportunities, whether that's training, data services. And then from there, if you choose training, we send a clinical educator on site to do your training. So that's basically my department, and we'll go from there. So annually, I told you I visit facilities. I visit about 75 facilities a year. And so while many tell me they don't flash or IUSS anymore, there's still quite a few that are. I will hear, oh, we haven't done one in about a year, or we do about one a year, which is great. But there's still some that are still doing this, and I know the trend is really to get away from doing it at all. And so when you look at the whys, why should we not be using IUSS? There's many reasons. And so today I'm here to show you how you can use CensiTrac to track those IUSS loads, create reports detailing what is being processed, and then what and when, and then help you get to a last resort only to be able to use IUSS. Back in the day, if something you had something missing out of a set, we would just leave it down, and if we need it, we'll flash it. And so that's kind of where we were back then. Now, as you know, nowadays it's kind of a no-no. And so we're going to help you get away from those no-nos and get you to hopefully minimal, hopefully zero. So for those seasoned healthcare workers like me, it was always called flash. I guarantee you I will say flash throughout this presentation because it slips. I think flash is just, it's there and it's easier to say than IUSS. So in 2009, flash changed to IUSS. Because flash refers to an open container that is being sterilized, flashed, and then brought into an OR. Then when flash packs and other closed containers came on, they kind of had to change that definition, change that wording. And then that's where the Immediate Use Steam Sterilization came about, or IUSS. But there again, I know I will slip and I'll say flash. Probably will say it till the end of times. But one thing about this is, did you know that Joint Commission has put forth critical steps for IUSS so that if a device is processed by IUSS and that device is processed or then used on a patient, you have to be able to trace that information to the patient. And so they have critical steps that are required, and that is cleaning and decontamination. So you have to show that it was cleaned and decontaminated and document that. Sterilization documentation, transferring the IUSS items, which I'm wondering if now that everything is so closed, is that really an issue? Maybe they'll get away from that one. but then also the frequency of use. So frequency of use is the big one, that they want to make sure that you have enough instruments. So Joint Commission states that lack of instrumentation is not an excuse for IUSS. But why all the concern? Why the discussion, the debate? When you think about it, the critical part of sterilization is that exposure time in there, and that's being met. So you have to ask yourself, well, so then why? Why can't we use IUSS? What's the big deal with it? But you think about, did it go through that full cleaning process? Did it go to decontam? Did it go through the sink, get that hand washed? Did it then go through a mechanical washer? And then from there, go to that IUSS sterilizer. And the big thing there is it's that cleaning. So you think about, did it really go through all that? And I think back in the day when I was a scrub tech many years ago, that if we needed stuff for our next case and it was just a turnover, as they took that patient out of the room, I would literally go to the hand wash sink, wash that instrument, put it in that open flash pan, and then go put it in a sterilizer. I'd go in, set up for my case, and then when that was done, somebody would come in and bring me that, they come in and bring me that container with my item in it. And so those days are done, no more open for sure. And that was, and we were doing that because we didn't have enough instruments. So with specific containers and being geared for IUSS, that has helped. So I don't think that's so much the issue, it's the cleaning. And you have to really wonder if an instrument's dropped or contaminated during the procedure and the patient's on the table, are they really going to wait while it goes down to decontam, goes through the sink for that, hand cleaning, and then goes into the washer, then comes to the IUSS sterilizer. So we're looking at least an hour between that mechanical washer and then into the sterilizer, and then back out to the field. And then where it's cool enough, we usually just dunk it in cold water. Well, then we learned you couldn't do that because it's hard on the stainless steel, it will crack and everything. Are they really going to allow a patient to just lay there on the table, put that OR at a standstill? So you have to question, is it being cleaned? And especially in hospitals or facilities where you have an OR that does it. So if the OR is doing their own IUSS sterilization, is there a mechanical washer up there? I'm guessing no. And, or if they're sending it down to be washed, great. But then that's even more time for transferring all that. And so there's a lot of concern about that cleaning. And as you know, if you don't get it clean, then you sterilize it. Now you're creating biofilm. So there's just, bottom line is every facility should have enough instrumentation so that they don't have to do IUSS if they contaminate during a procedure, or that they have enough instrumentation so that they can do enough, that their surgeries that are on the schedule. One second here, sorry. So with that, if you were to Google flash sterilization, IUSS sterilization, you're going to see all kinds of articles, information, even dating way back about the controversy and everything with that. So on to our next slide is, can this be done? Yes. At my facility that I was at, we were flashing about 480 a year. Yeah, about 480 times a year. The goal was to get that down to 0. And when I left, we were down to 24 a year. Last I heard, we were at 0. So what I did is start documenting these IUSS loads, then put it in an Excel format, run those reports, look at that, look for those trends, look for what's happening here. And it's one thing when you have something that's contaminated. It's one thing with if you only have, if you have 2 of these and you schedule 2 procedures that day and something happens, you're going to run into those. But those need to be addressed. What I was seeing was one of our trays that was IUSS a lot is our rectal tray. So you look at those procedures, and those procedures, they're quick. They're about 30 with turnover, maybe 45 minutes. And we had 5 trays. And when I looked at the schedule, they would schedule 12 back to back. So there was no time for them to finish that case, get that case cart down to decontam, and then get it cleaned and get it sterilized and everything and get them back up. So we were flashing, or IUSS. So that was an easy one. because to replace or buy more instruments was not that expensive. At the time, I thought, all right, if I had 7 trays, that would be great, because we're doing 12 a day. Let's do 7. I'm a firm believer, and I was asking more than what you actually need, or ask for more than what you could get by with. So I asked for 7, knowing that I'd probably get approved for 5. And I was right. I asked for 7, did everything, filled it out. Here's what's going to cost. Here's the why, and was approved for 5. We did that, and then never had to IUSS those trays again. And that was an easy one, because it's pretty standard stainless steel instruments. You know, it's not like this $25,000 spine instrument or something. So that wasn't easy. But with that, our numbers dropped drastically. Along with that, I looked to see what else is on there. You know, where am I seeing? And one of our Synthes trays was continually having holes in the wrapper. And I put a stop to that, because our OR was flashing and there were implants in that. So that was a whole nother nightmare on the side. But then we stopped them doing the flashing. IUSS, we took it back. So they were no longer doing that. But then realizing, okay, if I see holes in wrappers and there's a trend here, it's happening a couple times, I know they need to use corner protectors. They need to put it in a rigid container. What's the weight on that tray? Do we need to take some of that weight out? So anything that you can do to identify and then reduce that. So when you're in CensiTrac and you say, okay, how can I use CensiTrac to document my IUSS loads? If you have sterilizers that are specific and they're only used for IUSS, then great, you can just set it so those are the only cycles on there, along with your buoy dick. But then at the same time, if it's a sterilizer that's used for regular loads, not a problem. What you want to do is go into reprocessing machines. So administration, reprocessing machines, go to that machine and then set that up. So in here with that machine, you then can set up those IUSS cycles, or if they're just label them IUSS. And then you're going to then also unload details, make sure you have the reason identified. And with this too, if you need help with this, your client manager, the help desk, they can always help you set up your machines if you're not familiar with that. Or if you're in leadership, or if you're new and not that familiar with CensiTrac, we do offer CensiTrac Essentials for Management. That's a CEM course. You can find out more about that either on our customer portal, through your client manager, or the help desk. And so with that, we're always happy to help you set everything up and get it going. Along with this, you want to set up your reasons. So why do we need to use IUSS? So if you are on the administration, and then you go to lists, and then click on load reasons. So in here is where you're going to put in there, what are your reasons? Now I recommend keeping this short and sweet. If I have to scroll through 50 reasons or 25 reasons, I'm just going to get tired and click on whatever. The other thing I recommend is always having an other in there, because if someone can't find their reason, then they're going to probably not use CensiTrac, or they're just going to click on whatever, and you're going to have false information. So I put other, but explain in notes. So in that load list section, you're going to go in and explain the reason. Many times I found when you do that and they type something in, I can throw it into one of my categories. Then you have to encourage everyone to use it. Make it a requirement, explain this is the why. And really, I think no one really likes to have to use IUSS because it's rush, rush, rush. I'd rather have enough instruments. I'd rather have everything that we need so that we don't have to use this. And so on here, you can see my list, just some common reasons there. Contaminated in OR. I always like to have that in there. Hopefully they're honest and say, well, what happened? Because you may find a trend there that it's always the same OR, it's always the same tech, it's always the same surgeon, or who knows. So then with this, you set this up, and then you have those reasons in there, so that as I am creating my load, I can select my reason. Along with this, many times you see it's just one instrument. If it's a container, I can always go and scan right to my CensiTrac. I can always go and scan right in there that container. But if it's a peel pack, what am I going to do? So I recommend creating a peel pack that says for single instruments. Label it IUSS peel pack. You can always run that report to see how many times we're doing this, but it's also then going to be identified when you run your report of all your IUSS loads. But here you see I put in there too, identifying notes. I recommend educating people. Don't just put retractor. Don't just put clamp. Tell me what it is. I need to know what it is. So then I know, do I need to buy more? Do we need some backup? And so taking it one step further, if they can put in there the manufacturer and the item number, even better, because then if I'm seeing this, I know that then I need to order this and I know I'm going to get the correct one. So if I'm seeing Asculap ABC-123, then I know now, yep, that's the instrument I need to order. Not just guessing that this is the correct vascular clamp or something. So get that in there, print that off, and whether you put that label on your IUSS sterilizers or you have it, somewhere handy so that it's always there and they can just scan that, not have to print out a label each time. Along with that, then you're going to look at your policy. So many times people will say, well, do you have a policy with IUSS? Do you have any kind of SOP that we can use, you recommend? And we don't, because it really, everything has to be hospital specific. And when you're creating these, it's always that life or limb you've taken into consideration, but then also what I consider life or limb versus you consider life or limb could be two different things. And so with this, when you create that policy, you want to be specific in explaining when is IUSS permitted and then what can be processed. So when I talked about flashing or IUSSing implants, if people don't know, this is how we're going to educate them. Let them know that can't be done, no implants. Along with that then is when is it permitted? One thing with CensiTrac is I recommend using the instrument search. So if you're in a case and let's say you're doing a thyroid and the green goiter gets contaminated and you need another one and you don't have another radical neck tray. So go into instrument search, type that in there. Well, little did you know, Dr. Smith has one in his foot and ankle tray for some reason. Well, you look at the foot and ankle tray and you see there's one sitting on the shelf. You run, grab it. You totally just avoided a whole IUSS need by simply looking to see that instrument search and seeing what's available, where's it at. Now that's probably going to be more your ORs that need to use that, but it's easy to use. They would probably much rather learn that and use that than having to scramble and run around or IUSS something that maybe they didn't have to. Or when they call and say, hey, we have something that we need to process by IUSS, always say to them, what is it? I need to know exactly what it is. So then you can do that instrument search and see if it's someplace else, if we have it somewhere. Along with that, when you're creating this policy, don't forget to explain the reason. So they have to explain that reason. And then when you're doing this, I recommend running the report weekly, just in case someone didn't fill in that reason. You can then go right to them and ask them why it's still fresh in their mind. And then also with the peel pack, making sure that in that notes section, they're listing in there what it was. So it's fresh in their mind, they'll know. So then when it comes to your policies, you may need to write separate ones for your OR and your SPD or SPS versus using the same one. So that way, yes, everyone needs that same information, but at the same time, that OR one, you're also going to pull into that though, the without its, how am I trying to say this? So basically you don't want it written or coming across wrong so that your OR, so anyone that works in the OR knows you've got that surgical conscience. You don't want someone to think that IUS is so bad, oh my gosh, I just contaminated this, but if I say something, I'm going to get in trouble. Or, I'm going to get written up, which should never happen because accidents happen. You don't want them to compromise patient care. You want them to speak up and say, hey, I just contaminated this. I need another one. Whether it's a tech, a doctor, a med student, whoever. So we need to make sure that we are writing that policy so that it doesn't come across as shaming, writing it that IUSS is a total last resort. And if your policy is to say we just don't do it at all anymore, I mean, I know facilities that we just don't do it. It's not even an option. Okay, but then what is your option when you have a patient on the table and something happens? It's one thing to not start the case, but it's another thing when the patient's on the table and something happens. So you've got to be really careful with this, really evaluate it. I would get some people to read through it so you get some different opinions and then go from there. Give me 1 second here. My computer shut off. So onto the process. So when you're going to create that IUSS load, and now we're going to be documenting this in CensiTrac, you're going to document it just like all your other loads. You're going to create that load just like any other sterilizer load. But then along with that, you're going to document that IUSS information. So scan your sterilizer like you would any other time. Scan the container or that peel pack. And then if you scan a biological to yours, you're going to add that. If you process a biological with every load, and then send scan data. Now, put it in, get it started. But then you want to go into your load list. And then from the drop down where it says reason, select your reason. Or if it's peel pack in that notes section, put in there that peel pack or that instrument information. Like I said, if you can use the manufacturer, the item number, wonderful, kudos, because then we know. And then along with that, if there's any other information, anything that you feel would be important, I always kind of feel like the more information, the better. So then that we can really drill down and figure out what's going on. Because some of those aren't as easy, like our rectal tray for those surgeries, some were not as easy. And I really had to dig. I really had to look through and say, why? And if it was a reason that was just not valid, I brought it right to the OR leadership and said, hey, this was done yesterday and there's no reason for it. They didn't even look, this instrument's in these sets. They didn't even ask us, they didn't. So it's just really spending that time and drilling down. And so for that IUSS process, I said, you're going to document that reason. And then along with that, then let your load run and then just document it as usual. So the key thing here though, is when you're documenting that, you want to make sure, so if you have a pre-vac 274 and 1, do not select that one. I would take that out. In your cycles, go in and uncheck that box so they can't even use that one. I would go and make sure they're always using that IUSS cycle. So if it's IUSS 274 and 1, now we know that, here's my documentation to show that I am using IUSS, and it's easier to run your reports and then find that. On to reports. So in the report section of CensiTrac, if you click on reports, you go to the sterilization section, find that sterilizer load summary. Here's where you're going to play around with the information that you want. Maybe you don't care who processed the load. I always liked it because if I had any questions, I know who to go talk to. And then along with that then is your time frame. So this here shows I just ran it for the last 3 months. So you're going to probably run it maybe weekly, monthly, as you're starting to do this. Then you're going to see you're going to get down to, I want to look at the bigger picture. So 3 months, 6 months, a year to really say how many times did we end up having to process this by IUSS. And it may be only once per quarter. But if it's a critical case, something that shouldn't be, not best for the patient, then you may have to look at this and consider buying another set so that this doesn't have to happen. When you're in your reports, customize it, make sure you save it. So save. That way you have it, you don't have to recreate the wheel every time you go into it. And then if you do want, it'll save to that 3 months. So I'm looking now for a year. I'm just going to click on edit from that actions tab, change my time frame, and then there we go. So it's always there. And then when you do this, you run your report, you get that information. I recommend then exporting it to Excel. So here's how my report then looked in Excel. You do not have to be savvy with Excel. Don't ever worry about that. But all I did here is I just sorted by the column. I sorted here by the reason. So I just want to see what's going on. What are my reasons? This was an easy one because I could literally look at this and say, oh, all right, obviously a general major, carpal tunnel, those are our concerns. But here you can see where I have supplier and catalog number. So this was one that they were able to scan. So they must have had a peel pack, still in the peel pack label in the room, and able to scan it. I got my information. So you just look at this and say, okay, where are my commonalities? Where are my trends? And then what can I do with this? Next one on here is do your commonalities and your patterns. So reason, I always look at that reason. So if I'm seeing compromised packaging, if I'm seeing where there was something wrong in SPD processing something, I want to look for those trends. I want to find that pattern so I can say, all right, what's going on? How do I address this? Is there a commonality between that container or that instrument? So just trying to really look through. And then along with that, you may have to investigate. So is it always the same procedure? Well, maybe we should be putting big spine cases that have, the double back table or multiple back tables in room 7 because room 7 is too small. And, the staff have been telling leadership that, but now here's the proof. So no more spines in room 7. Get that into a bigger room. Look at the staff member. So remember I said, you don't want to be shaming. You don't want to ever have someone be afraid to say they contaminated. And so then with that, you still want to look at that though. So if you see it many times, and you may not even know that, but if you're seeing contaminated in the OR and you're seeing that trend, I would take that and those cases, and when that was done, and bring it to OR leadership. They can then look and see, okay, who is the tech in the room? With that, then they may know that tech needs some more education. Or that tech may say, that room's too small. And you don't realize that, oh, you know what, they're right. So we're kind of back to that. Is it the procedure that we're putting in that room? Or is it the tech? But maybe this tech always scrubs those spine cases, so that way it looks like it's always them. Missing integrator. When you see missing integrator, drill down, go into your container history. Who assembled that? If you find a trend in there with that missing integrator, to say who assembled it, who assembled it, who assembled it. And it's the same person, or one person has done it multiple times in the last 3 months or 6 months, then they're probably going to coincide with your quality feedback reports that you have in CensiTrac. And then they need some education. Simple education. I used to tell people, the minute you set your container on your workstation, grab your chemical integrators and put them right there with your instruments. So then they're there, and as you put everything in and your last instrument goes in, you still have chemical integrators, and now you put those in. So just educating and working and giving them some helpful hints. If it's debris, if they're having to flash because of dirty instruments or finding things in a container, look and see, go to that container history. Who assembled this? Or sorry, who cleaned this? So who cleaned this? Who scanned it to decontam? Because if there's true stuff that had it been a good pre-wash, it would have come off in the washer, then yes, some education is needed there. I look at it as decontam's always a little tricky. I think of when I take stuff out of my dishwasher at home, I look at it, make sure it's clean before I put it in the cupboard. Well, if you're in decontam, you can't look at it before it gets, goes to assembly because you're on the dirty side. So then that's where you rely on whoever's in assembly, that when they're doing that inspection, that they're looking. So really, if there's a dirty instrument, that really falls more on your assembly person, but there is some portion of that needs to be owned by decontam. So education there to say, hey, I know you know this set like the back of your hand, but I think you're going too fast. You're probably not inspecting. We need you to inspect and look and see. Along with that, some of these I would say, I hope they're doing a quality feedback report with that, taking a picture even. Picture speaks 1,000 words. So if I'm saying, hey, this had a dirty instrument in it. So we had to go IUSS it. If you have the webcam connected to a CensiTrac computer, great, you can use it right then and there, or you can take a picture with your phone and then get that added. But really take the time, drill down, investigate, and figure out why. One of the commonalities I know I always see, oh, it's loaner sets. It's loaner sets. They arrive late. That sounds like a whole facility loaner policy you need to work on. Maybe you feel like they arrive late. I don't know. LoanerLink, one of our products, is a great tool for that, because that rep will be getting reminders basically saying, get your stuff here now, your stuff's overdue. And then you've got that full documentation. When was it checked in? You know, when did it arrive? When was it supposed to arrive? So there's different tools you can use, but just basically using basic CensiTrac, the minute that loaner set is checked in and then scan and decontam, you can see then, yeah, you're right. We didn't have time to process it. It came out of decontam when we had to go IUSS it because of the loaner sets that arrived late. But I always do that root cause analysis. I always figure out, excuse me, do that because that RCA will help you to identify what's happening, why is it happening, and then basically from there say, okay, how can we prevent it? So what needs to be done? I can look at this, and this was a pretty easy one, to say, yes, general major, compromised packaging. I need to look at these and say, why? What's going on here? Why is this? What happened here? Well, maybe this, so general major number 6, the rigid container broke, and so we've been wrapping it. And because I would say, well, why do we have 3 times in July, 3 times in August, but nothing in June? Something's weird. And you find out, yes, it's being wrapped. Okay, well, we either need to put corner protectors when we wrap it, or we need to open up a container that's maybe not used that often. Or, we all have those one emergency containers that get used once a year, those ones that we just can't get rid of. Maybe open up that one and wrap it, put it back on the shelf, and then take that container, put the general major in it until that new one arrives. That way, that one's not being used. It's just sitting there if we need it. However, I've taken care of this general major. Or can I pull it? Can I pull it and we're not even going to process it? We're going to leave it down until the rigid container gets here. But be careful, because I don't want that to end up meaning that, okay, but then now we have to flash or IUSS our general major trays because of the fact that we don't have, because we're short. So be careful with that one, but at the same time, drill down and figure it out. Carpal tunnel, this one is, basically it's kind of like our rectal tray, where it's a quick procedure. We don't have enough. I know our carpal tunnels, we would schedule them for, I think we were doing like 30 minutes, and then every 4th one was 45, just so that way it could get caught up if it was run a little late. Or maybe it was always 45 and then the last one was 30, but it's been a long time. So with this, you look at this and say, okay, obviously we need to purchase some more carpal tunnel trays. And if we're having to flash for IUSS, 3, 4, 5 times a month, we'll then go look and do that analysis. How many do we have on the shelf? And what is the typical schedule? It could be that maybe when the surgeon's here on their block day, it's fine because they're the only one. But on this block day, they gave 2 hand surgeons block, and now we don't have enough. Well, do they want to readjust that block, see what we can do, or do they want to purchase more trays? Obviously, it'd be a lot cheaper to just move that block, but we know that's easier said than done because they have their schedules for their clinic and their OR times. So you really have to work with OR, work with leadership to say, what can we do here? Fortunately, here again, these are basic stainless steel instruments, so not really expensive. And that's typically the case. A lot of your stuff that's not your basic stainless steel can't be IUSS anyways. So you just have to really drill down, look at it, and then see what's going on. So when I look at this carpal tunnel one, right there, that would be a red flag for Joint Commission. So they look at your IUSS report, And one, if you're not recording it, you don't have a report to show them, you're probably going to be having a conversation with them. So if you are, you need to have that report. They're going to look at this and say, okay, what's going on here? All right, it looks like I can see where you don't have enough instrumentation because you're having to IUSS sets, 3 times on this given days. So that would be a surgeon has a block, or just whenever that surgeon comes in and gets a whole day. So years ago, working in the OR, and when we did our eye trays, we flashed, or well, back then it was flashed, but we flashed all of our cataract trays. So on eye day, we literally had one person assigned that they were the eye room flasher, and that was their assignment for the day. And they would take that, go to the sink, wash it, and then put it in the sterilizer. So yes, this opens a whole can of worms with cleaning eye instruments, which we won't go down with the whole TAS syndrome. But you look at that and say, wow, this was crazy. And we got cited by Joint Commission. And with that, then it was a quick, okay, do we go and not do as many eyes in one day? Do we divide that block up into 2 days? Or do we go purchase more instruments? And obviously we purchase more instruments because they're not going to turn away surgeries. And eye instruments are expensive. So it was not a cheap thing to do. But there again, had to show Joint Commission, yes, we purchased the eye instruments. Here's how many sets we have now. So we took care of the issue. But back then you could flash all you wanted to, and it wasn't an issue. And then when Joint Commission kind of put that on the radar, then that made big changes. And so it's not like we thought we were doing anything wrong. It was just a different way of doing it. So like I said, it can be done. It's just a matter of identifying and then working with your leadership to identify what's there and then address and get those things. So at this time, I'd like to open up to questions and answers. Thank you for participating in today's event. At the bottom here is our information. So if you need assistance with someone, you need assistance setting up your sterilizers, how to set up the IUSS, you can always reach out to us. This presentation will be available on our customer portal. Probably about a week or two, it'll be on there. So you can always come back and kind of review this or share it with your OR. So if you're trying to, tell them, hey, we shouldn't be processing by IUSS, well, right here saying, here's why, and here's how we can do this. And maybe it's just as a staff meeting where you just go through this with the OR and say, so we can do this. Let's make this our goal for 2022 and start purchasing instruments. Let's get that into our capital budget to purchase instruments and get away from that. So as we go to question and answers, my coworker Cody is going to be helping me out here. Cody, do you have questions for me?
I do. Let's see. One of the questions that we had here is, is this to make this process easier? Do you need to have CensiTrac installed in the OR? And does the OR staff need to be trained on how to document that, or is that kind of a facility decision?
So I would say that's a facility decision. Yes, you can put CensiTrac on the OR computers, and they just need a scanner, and then they could be documenting those IUSS loads. However, if that works for them and that's what they want to do, they want to stay in control of that, so they're doing the IUSS, great. But then I hope that somebody is running those reports on a weekly basis, maybe starting out, or maybe monthly, depending on how often it's happening, to make sure that they're really trying to not have to. I've had facilities that have said, we took it away from the OR, and now they have to have something IUSS, they have to call SPD, and then we go up and get the instrument, we bring it down, we wash it, put it through the mechanical washer, we bring it up there, then we put it in the sterilizer. When it's done, the OR hears the beep, beep, beep. So they'll go in and they'll grab it and they'll take it. And then SPD comes up and then grabs the tape and documents the load. But they've said since we started that process, that they have to call us, our numbers drop drastically, because then they'll figure something else out. They'll use something else. So we know that there's sometimes it's probably not needed, but I'd rather just flash this or IUSS this. Then I would rather have to call, go look for it. And now that I have to call you guys, forget it. I'll just go look for a different instrument.
All right, we got a question here in the chat. It says, is there a way we can put an alert on a container or a tray to alert a tech that the container cannot be IUSS once scanned to an IUSS cycle?
So what you would do is you go into that container, so that in that container type, if you saw my last presentation last month, we talked about that container type section. And in there, you could put a sterilization comment that says, this cannot be processed via IUSS. So if I'm then creating a sterilizer load and I'm going to scan it to that, I'll get that pop-up saying, this can't be processed by IUSS.
All right. We got another question here. It says, we run an IUSS test every day. To narrow that field down, what do you think of putting a new cycle in CensiTrac for the IUSS tests?
Yep. So there you'd have to decide. I said get away from that pre-vac 274 and 1. So do you want that documented as a 274 and 1? But then make sure that staff are understanding, never select that for your IUSS load. That's only to be used for your biological. So you could always do that. And then you still have that 270. Or if you are using it as that IUSS 274 and 1, then when you run that report and you filter, you just filter those ones out.
Thank you, Kelly. Let's see. I have another question here. What happens when I don't have instrument search as an option? Is there another way to find an instrument?
So you should be able to, because when you have instrument search, but you also have another option. You can go into your products, and everyone has products. You can go into products, type in green goiter, see what's in there, and click on where is it used, or where is it used, Cody? I think it says where is it used.
Yeah, so you can go in there and you can find the trays it's used in.
Yes.
Now, if you were trying to find trays it's looked in, that you'd be able to use that product way.
Yep.
If you don't have the instrument search, my guess would be that you're at a base track level versus an advanced level. The difference between the two is you can track down to the individual instrument if you're an advanced customer versus someone that has a base subscription.
Yep.
Let's see. Any more questions? Folks, feel free to throw them in the into the chat here. Let's see. I don't know if I have that many other questions here. I think I have one last question. It says, can IUSS be a gravity cycle or is it all pre-vac now?
So, years ago, I remember hearing that it only could be pre-vac. And so that was my thoughts. As I was putting together this presentation and I'm looking in the ISHM handbook, the manual, there was talk about it can be gravity. So honestly, I didn't read up enough on it to see, can it be gravity? Can it be pre-vac or only pre-vac? So that I don't know the answer to, but now I'm going to find it out because I should have read that section. But when I saw that, I thought, oh, that doesn't matter. And I just kept on going. I should have read it.
Thank you.
And then Cody, you do have some in the CtUC back channel. There are questions in there.
Yep, I've actually read a couple of those already.
So good, because we have some questions coming through that are being kind of.
So I just want to make sure we got one last one here that I think I don't know if you'll be able to answer this or not, but his question was, I was working with a client manager regarding the compromised packing scan barcode. And when we scanned it, as we were pulling it in the sterilizer with the other items, they were not compromised. We realized it does not attach to just that one item, but to all of them instead. So it sounds like, Zach, if you can throw something in the chat here. So it sounds like you're scanning a compromised barcode sticker into the sterilizer to account for that item on why you're rerunning it.
because yeah, no, I'm not familiar with that process of scanning that barcode to a sterilizer load.
Let's see if he can post something in the chat here.
I'm looking.
And then I guess while we're waiting for his response, one other thing that I forgot to mention is, what do you do with trays that need to be one tray? How would you use the CensiTrac to capture that process?
Yep. So, you know, with use of one tray, I do see that many sites will now say we no longer IUSS because we have one tray. So aside from one tray, and aside from the fact that you can do that IUSS cycle for the most part, my concern is we're back to that same part with cleaning. Did you clean it like you should? Did it go through that mechanical washer? If it requires ultrasonic, did it go through the ultrasonic? So that's where you want to drill down. You have to do that root cause analysis on your one tray sets to say, okay, yes, it's validated for sterilization and it's not considered IUSS. However, was it clean like it was supposed to be? Did I meet that manufacturer's IFU with my cleaning? And if you're not, then you're just covering it up. Now, if you are still doing it, you are doing thorough cleaning, you could always go and create a one tray cycle. So rather than naming the cycle IUSS, you name it one tray. And then with that, you go and start running that report with your one trays. Because here's what when I think of quick turnovers, having to, IUSS, even just quick turnovers during the day, as you see, I mean, I think every sterile processing department I go into is short staffed. And if not, I would say at least 95% of them are short staffed. You see every day the staffing issues. And the last thing we want to do is have people rushing, stressed out. But that seems to be a commonality going on in sterile processing. So if I'm having to do all these quick turnovers and rush, because we don't really have enough instruments to meet that scheduled needs, then if you're using one tray, you could be covering it up. And then you're still in that kind of that situation where, yes, but we have that stress. We have that rush. And then when you're rushing, are you doing a full inspection? Maybe that's why we're ending up with dirty instruments. I didn't see that there was still cement on that cement gun because I was hurrying. I didn't put this retractor together the way it was supposed to be. So when the tech picked it up, a piece of it fell on the floor. It was then now contaminated. So you have to really just look at your uses and your reasons behind that, and then go from there. So, I mean, one tray can be a great thing, but not if it's a Band-Aid or a cover up to a problem that's going on.
All right. Another question we have here is, do I have to use the same form in CensiTrac from load results for IUSS sterilization as my steam terminal loads?
So yes, it's right there in load list. So just what your staff and you are used to every day, you're gonna do the same thing. If there's a biological, you're gonna go to load indicators, put that biological in so it can start in that incubator, then go to load list, document that load is pass fail, select your reason for the that should already be in there, your reason, and then select your IUSS 274 and 1 or whatever cycle you write it on. So you want to make sure that you're doing that. And even if your sterilizers are interfaced, make sure that you have an IUSS cycle indicated in there, and then make sure they're running it on that cycle. So you can it'll send it over your interfaced, but then you can run that report. If it's interfaced and you can't change the wording, reach out to your sterilizer rep. They should be able to assist you with this, get this fixed. If not, you could run a report where you're just looking at reasons. So if you're really only using the reasons when it's an IUSS, you could run that report based on reasons versus IUSS cycle, and then you'll get that information.
Let's see. I don't know. It looks like the question in the chat was answered. Let's see. So Zach puts, we do not IUSS anymore, but instead we want to scan the barcode to a sterilizer load. It then attaches everything in that load. However, we want to be able to track just the compromised item for our own reporting. The only way we found it would work is to scan the item with a compromised item and run it alone. But that ties up a huge sterilizer for just one item. We would like to show just for that one item and still be able to run the other items in the sterilizer with it. And so Adele put in there, Zachary, use the quality feedback event
Yep.
could be created for that. And so
Yep.
that's exactly what we would recommend there. Creating that event, that way you can capture that one item. And you can, if it's a tray, you could even capture it to the tray. If you guys are an instrument mark, you guys can track it to that particular item.
Yep. And for those that don't know, so if you're not familiar with our quality feedback module, you now can print off a barcode. So you have options. You can go into workflow, quality feedback, fill all the information, and then save it. You create that document. But if you want, some staff like, oh no, I don't have time for that. They just fill out the paper. I'm not a fan of the paper. I can tell you stories about that paper, or my night shift was going out and taking the ones out of my file that the OR would leave me, or my mailbox, if it was for them or their friends. So yeah, do the electronic, because there's no one can alter it. But go in and use quality feedback in that workflow module, or you can go and create a barcode. So when we talked about that list where you see load reasons, there's also then your quality feedback reasons in there, and go to there, and then you can sort. So I can put in, here's what applies to decontam. Here's what applies to assembly, sterilization, sterile storage, the OR. And then when something happens, I have a barcode. So I just scan the barcode, scan the container, scan the barcode, done. 3 simple scans, took me probably 4 seconds. And then with that, I created a quality feedback form. Now, if you want to add a picture, yes, you need to go together and use a quality feedback. But with that, what a great way to document. I have customers now using it for no pre-cleaning decontam, or if a sharps comes through, it's super easy for your staff because they're already in there. They're already in CensiTrac. They just scan, scan, scan. They're done. You've got the information. Same thing then would be what he's saying, something was compromised, so we had to throw it in the sterilizer. Then use that quality feedback to say compromised, and then you could document that IUSS load and then say why. Any other questions? Or
I think that wraps up all the questions that we have in the chat so far, unless anybody has any other questions. We went ahead and posted the CE certificate into the chat with the keyword of IUSS. Go there and get your CEUs, and then that's all for me, Kelly.
Yep, thank you, Cody. And so as Cody said, we have the link here. You go to there. When you're filling that out, you're going to ask, what's the keyword? IUSS. So easy to remember, because that's what the focus was today. If you have any questions for me, want to learn more about what my team does, Cody's on my team. So as part of what we do, anything, want to learn more at that, just reach out to our Census Help Desk, that 888 number there, and we can talk more. So I'd love to come see you guys. Love to come to every facility. Someday we'll get there. But thank you, everyone. Have a great rest of your day. Stay safe and sane in this crazy pandemic world. And join us this afternoon, where I'll be doing another presentation, hands-on presentation on quality audits. So working to help you get to paperless. Let's save those trees and let's get totally electronic for ease of use, ease of reporting, everything. Thank you, and we'll talk to you this afternoon.